I'm Dr. Raymond Douglas. I'm a professor of ophthalmology at Cedars-Sinai Medical Center and also in private practice in Beverly Hills. And I am an oculoplastic and orbital surgeon, so I spend most of my time dealing with and trying to help patients with thyroid eye disease and other orbital problems. I was also the investigator on Phase 2 and the co-principal investigator on Phase 3 for the clinical trial looking at teprotumumab for thyroid eye disease. TEPEZZA is indicated for thyroid eye disease. In a recent clinical trial, TEPEZZA was shown to reduce the signs and symptoms of thyroid eye disease, the proptosis, the double vision, and improve the quality of life for these patients. TEPEZZA is a human antibody to the IGF-1 receptor, the insulin-like growth factor 1 receptor. This receptor is overexpressed on the tissue of thyroid eye disease, meaning the fat around the eyes, the muscle tissue, and it's overexpressed in patients who have thyroid eye disease. And TEPEZZA is an antibody that binds that receptor and doesn't activate it like the immune system does, but then interferes with the immune system and potentially even the metabolism of these cells to cause reversal of the disease. TEPEZZA is given to patients via IV or intravenously. It's given over a course of about 60 to 90 minutes, and then it's given every 3 weeks thereafter. Total of 8 infusions are given during the course of therapy. For the first 2 infusions, they're given over 90 minutes, and if they're tolerated well, then the remaining 6 infusions are given over 60 minutes each. TEPEZZA in the clinical trial started to show effects in about 56% of the patients very early, after 6 weeks. So it appears to have an early onset for many patients. TEPEZZA also differs from any of the other medications that have been used in this disease in the past because it's a specific and targeted therapy. It targets the expression of the IGF-1 receptor, and in this way, it really inhibits the disease at its core. The other therapies that have been used in the past have all been non-specific therapies, mostly immune system blockers and immune system inhibitors. Patients who are considering TEPEZZA should have a diagnosis of thyroid eye disease. They should also have a discussion with their doctor who may be prescribing this medication and maybe have some routine blood tests, which would include a glucose level examination in addition to full past medical history, which could reveal any reasons not to take this medication. The most common side effects that were observed with TEPEZZA were muscle spasms, and this was mostly occurred in the evening and were muscle cramps in my experience, and patients typically tolerated these fairly well. There were also other symptoms, including mild hair loss, and this was all over the body and wasn't subject to one particular location. Some patients also experienced diarrhea, and there was also a small minority of patients who had changes in their hearing, but these overall resolved in almost all patients. My advice for someone who's considering TEPEZZA would be to first consult with your physician. You want to have a diagnosis of thyroid eye disease, but you really want to understand the risks and benefits potentially of this drug. For example, the data that demonstrates in the clinical trial an improvement of the proptosis and the double vision, which can be very significant for patients. Proptosis is when the tissue behind the eye increases in size and the eye actually pushes forward due to all the tissue that's accumulating behind the eye. And that can be due to the increase in the muscle size or the fat behind the eye. Sometimes increases in muscle size also can lead to scarring and double vision, and these are really concerning for patients with thyroid eye disease. One thing to consider in use of TEPEZZA is if you have a history of inflammatory bowel disease. TEPEZZA could make inflammatory bowel disease worse, or the symptoms of that disease worse. TEPEZZA can cause an increase in blood sugar, so anyone who has diabetes, or maybe even pre-diabetic where this is followed with their physician, should consult their physician prior to taking TEPEZZA to know and to follow their blood glucose levels throughout treatment. Hearing impairment was also noted with TEPEZZA. This was relatively mild to moderate for the patients who reported it. And in my clinical experience, this was more of a stuffiness of the ears or a very mild impairment that they noticed, but did not require any extra aids or anything supplemental during their treatment period. In almost all cases, this was reversible. Typically, TEPEZZA infusions were very well tolerated in the clinical trial. There were 3 patients who had infusion reactions. These were relatively mild and well controlled, and there were no anaphylactic reactions that occurred during treatment with TEPEZZA. Anaphylactic reactions are allergic and severe reactions that typically occur within 2 hours of infusion. And again, these were not noted with TEPEZZA. Pregnancy should be avoided with the use of TEPEZZA, so it would be very important to discuss this with your doctor prior to considering or becoming pregnant. I'm thrilled that TEPEZZA has now become FDA approved because for the first time we have a drug that can potentially change the signs and symptoms of this disease without surgery and without medications that cause exorbitant side effects for these patients. So it really is an exciting time for this very breakthrough medication.